Chris going in on the verse, cause I never been defeated and I won't stop now. Keep your hands up, get them in the sky for the homies that ain't making it, my folks locked down. I never win no.
Sir, are you okay? It seems you damaged your axial skeleton, including your skull, spine, and ribs. Out of all the bones in your skull, including the frontal, parietal, occipital, temporal, sphenoid, ethmoid, lacrimal, vomer, nasal, zygomatic, maxilla, mandible, and the palatine, also the hole that connects your skull to your spine, the foramen magnum. When it comes to your spine, there's 5 regions. The first 7 vertebrae are known as your cervical, the next 12 are known as your thoracic, and the last 5 are known as your lumbar. Below them are including your sacrum and your coccyx, and the first 2 cervical bones are known as your atlas and axis. As for your ribs, ribs 1 through 7 are true, 8 through 12 are false, and 11 out of 12 are floating. You've also damaged your sternum, but you'll be okay.
Sir, it looks like you damaged your appendicular skeleton. Starting with the most superior part of your appendicular skeleton, you have your scapula and your clavicle. Now part of your pectoral girdle, you're gonna have your humerus, your radius, your ulna, your carpals, your metacarpals, and your phalanges. Now we have your pelvic girdle, which is made up of your pelvis, which you have the ilium, the ischium, and the pubis. It's also made up of the femur, the patella, the tibia, the fibula, your tarsals, your metatarsals, and your phalanges. Ooh. This little pig went to the market. This little piggy stayed home. This little piggy had roast beef. This little piggy had none. And this little piggy went wee, 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 all the way. Baby, I'm coming! Your axial skeleton is made up of flat bones, such as your cranial bones, and irregular bones, such as your spine. Now your appendicular skeleton is made up of long bones, such as your humerus, and short bones, such as your tarsals.
The axial skeleton is for protection. The appendicular skeleton is for movement.
Benjamin's all in my pocket. I traded them.
The joints in your axial and appendicular skeleton can be classified into 3 categories: fibrous, cartilaginous, and synovial. Fibrous joints allow for no movement and can be found in the sutures of your skull. Cartilaginous joints allow for limited movement and can be found in between your vertebrae and your spine. Synovial joints allow for full range of motion and can be found in your pelvic joints.
Bone markings are important anatomical landmarks that reveal sites of muscle attachments, points of articulation, and sites of blood vessels and nerve passages. One type of bone marking is processes. Processes are parts of bones that stick out from the main body of the bone, serving as an attachment site for muscles, ligaments, or other connective tissues. Another type of bone markings is a foramen, which is any opening in the bones. A fossa is an articular depression or a shallow groove. A tubercle is a small rounded projection, which can be found in the femur of the thigh at the distal end. A sinus is a cavity within a bone, filled with air and lined with mucous membrane. Example is it's found in the skull. The head, when using the femur as an example, is the structure that articulates with the pelvis. An articulation is a site where 2 bones meet. Gliding joints. Flat articular surfaces that slide by neighboring bones.
A hinge joint permits movement in only one plane. For example, flexion and extension, which is made up by fossas.
Saddle joint. Biaxial joints found only at the junction between the thumb and the metacarpals.
Ball and socket joints are where spherical head of one bone fits into a cup-shaped fossa of another bone. Example, for your shoulder or your hip.
Compact and spongy bone.
An epiphysis is the ends of a long bone. Proximal being the uppermost part of the bone, and distal being the bottommost part of the bone, which contains spongy and compact bone and articulary cartilage. Spongy bone is trabecular bone inside the epiphysis that absorbs shock. Also inside the proximal epiphysis, you have your epiphyseal plate line, where the bone grows. Now you have the diaphysis, which is the middlemost part of the bone and contains compact bone. Compact bone is dense external walls of long bones. The medullary cavity is the cavity of the diaphysis. It contains red and yellow bone marrow. Red bone marrow is a substance composed of red and white blood cells. Yellow marrow is fatty connective tissue and no longer productive of blood cells. Periosteum is fibrous, cellular, vestibular, and highly sensitive life support shelf for bone. Articulatory cartilage is smooth and slippery and bloodless. It is a massage by movement, permitting absorption of synovial fluid, oxygen, and nutrition.
Collagen, the main structural protein found in connective tissue. Calcium, added to bones by cells called osteoblasts, removed from bone by osteoclasts.
An osteocyte is the cell inside of a bone. An osteoclast destroys bone, and the osteoblast rebuilds the bone. You have the osteon, which is a fundamental function unit of compact bone. The lamella is the circular plate-like disc. And the lacuna is a cell just
For the rest of your days, it's our problem-free philosophy. Hakuna Matata.
The central canal is the canal that only goes up and down. The perforating canal is the canal that goes up and down, and it can go side to side.
I believe that if I fly, probably end up somewhere in paradise. I believe that if I fly, I'll probably end up somewhere in paradise.